Hello, I'm Trey Pleasance, U.S. Clinical Applications Manager for ODOS. Thank you for joining us for the fourth session of our summer webinar series, in which we seek to advance knowledge and skills in ophthalmology through Navilas, our novel navigated approach to retina laser, which employs on-screen digital camera interface, import and overlay of third-party diagnostic images, and active eye tracking to assist physicians in creating semi-automated laser treatment plans for the full spectrum of treatable retina pathologies. The features of Navilas have also made it an indispensable educational tool for doctors in training. And it's a pleasure for me to bring to you Dr. Kelly Donovan and Dr. Richard Morgan, Program Year 4 residents at Duke University Eye Center and the Durham VA Healthcare System in North Carolina. I'll see you again for a few closing thoughts at the end of their discussion. Doctors?
Good afternoon, everyone. Welcome to our resident run webinar on the Navilas laser system. My name is Richard Morgan, and I'm a current PGY4 ophthalmology resident here at Duke Eye Center.
Hi, I'm Kelly Donovan, also one of the PGY4 residents. We both work at the Duke Eye Center as well as the VA Healthcare System in North Carolina. So in this webinar, we'll be discussing our experience with the Navilas laser system and how we use it in our training program. I think most ophthalmology residents are very familiar with the traditional laser systems, indirect laser or laser indirect ophthalmoscopy, LAO, or direct or slit lamp laser. And most of these lasers are the tried and true gold standard for a wide variety of retina pathologies. And I guess that most residents get at least some experience with both. Our training program, in addition to indirect and direct laser, we also have the Navilas laser, which we found to be a valuable educational tool. But Navilas may be new or completely unknown to some of the trainees out there. So Richard, could you tell us what the Navilas laser system is?
Yeah, of course. So Navilas is a relatively new technology that combines a color fundus camera with fluorescein angiography and infrared imaging with a solid state laser. So the Navilas really stands out due to its real-time imaging and digital overlay features. It also combines computer-based targeting and eye tracking while providing a live view of the fundus on the screen. So it was really designed to integrate real-time diagnostic imaging with precise laser delivery technology.
Yeah. Before we learned how to use the Navilas, I learned how to use indirect laser and slit lamp laser. Richard, what about you?
Same here, Kelly. Like you, I started off with the indirect laser, and then I moved on to the slit lamp laser. And both of these tools were crucial for building my foundation in laser treatment.
Yeah.
So when I first started out using indirect laser and less often the slit lamp, over the past 1 to 2 years, I've really just been able to use those techniques and apply it towards the Navilas. And the Navilas has just completely revolutionized the way, or really streamlined the way in which I'm able to treat patients who require some type of laser treatment. And I've been able to share these insights with the rest of our resident cohort. So over the past 1 to 2 years, the majority of residents in our cohort really use the Navilas laser for our retinal laser needs. What made you personally switch from using the indirect laser and the slit lamp laser to the Navilas?
So like you, I'm pretty comfortable with those two laser platforms, but probably like a lot of trainees, I found that laser can be really challenging, especially with specific patient populations. So we've all had patients who are really photophobic. That can make it really difficult. Any patient who has a small pupil, it's really hard to get out into the periphery. And some patients just have trouble holding their gaze while we're trying to look at the retina, the periphery, and see the place that needs to get treatment. And those challenges are true for slit lamp as well as indirect. I think especially when you're first starting out learning how to do laser, and sometimes even now, you can not really be sure what you're looking at, and you frequently have to reorient yourself to make sure that you're not about to laser the macula. And so, these types of challenges come into our clinic, or challenging patients come into our clinic pretty frequently. And I think the Navilas has addressed a lot of these difficulties and made it easier for residents to learn how to do laser and feel comfortable doing laser. And for all of our patients, and whenever we're thinking about doing laser, we always need to think about how much treatment does each patient need and how much can we safely deliver to this patient. And this is determined by a combination of different things, including patient tolerance for the procedure, the degree of the patient's pathology, and then our ability to visualize the treatment area. You know, patients who get the most laser probably outside of the operating room are patients who have proliferative diabetic retinopathy and are laser naive. And for these patients in particular, the first round of treatment can take a really long time due to the high number of spots. Patients aren't familiar with getting laser and oftentimes need breaks in between treatments. So among the laser options available to us in our training program, I think I and most of our peers at this point would choose to use the Navilas for these types of patients. We found that in general, patients tolerate the overall process better. And the shorter duration of treatment is a huge advantage for clinic flow and the patient experience. How do you typically use Navilas in clinic, Richard?
Well, I think you mentioned it. In our clinic, we use a Navilas laser primarily for two general indications: proliferative diabetic retinopathy that requires PRP, and these are typically treatment-naive patients. We also use it for treatment of retinal horseshoe tears and retinal holes that are more in the periphery. So pre-procedure preparation involves a thorough review of diagnostic images and creating a detailed treatment plan with the help of our attendings and fellows.
Can you share with us what that actually looks like?
Yeah, absolutely. So in our clinic, PDR patients are typically referred to retina clinic for evaluation. These patients are typically presenting with advanced untreated disease. They're initially seen by our techs for review of system, evaluation of medical history, including recent A1C. Their visual acuity is measured, as well as their IOP. Their pupils are checked. They're dilated, all before being seen by photography. Once they're in our photography studio, we usually will get a baseline Optos photograph. We'll also get an FA if clinically necessary, and then we'll also get OCT imaging all at the same time. They're then evaluated by a resident ophthalmologist, and based on their DFE and entire clinical picture, the resident and attending design a treatment plan, which may include anti-VEGF therapy, PRP, or even surgical intervention, depending on what the patient really needs. And so there, if the patient is amenable to receiving PRP that same day, we'll go ahead and take them over to the Navilas treatment suite. And so what's really cool about the Navilas is that the system actually includes an IR and color camera that, when combined with a contact lens like the quadrispheric, for example, we're able to get a retinal image. And so once we have that retinal image on the system, it's essentially a map, if you will. The software overlays that map onto a live image of that patient's fundus. And it allows us to track landmarks on the fundus to ensure that any spot that we plan to treat lands on that region with high accuracy. So once we have the map, we'll go ahead and put a treatment plan onto the system, which may include no-go zones, as well as areas to fire the laser. And then the laser will automatically focus on the retina and rapidly apply the predefined laser treatment pattern once the operator presses down on the foot pedal. And it's a very rapid treatment.
Yeah, I think we've all found that for patients who require a lot of laser, it definitely saves a lot of time for us in clinic. And as I mentioned earlier, Navilas can be particularly helpful with certain types of patients. And compared to our attendings who have had decades of experience looking at all different kinds of eyes. As trainees, we've only been looking at eyes for a few years. So those patients who are photophobic, those who have small pupils can be really challenging. So I think that those are the patients who are, you know, really benefit a lot from trainees doing their laser with Navilas. So which patients do you usually typically use Navilas for in clinic?
Yeah, I think you actually hit the nail on the head, Kelly. Navilas is particularly well suited for patients where maintaining a view into the periphery is challenging, such as those with small pupils or difficulty maintaining a stable head position in the chair for an extended period of time. Thanks to the IR camera and digital overlay system within the Navilas, a snapshot of the retina can be taken and treatment planned while the patient's in a relaxed position. So they don't have to maintain that uncomfortable positioning for an extended period of time. And then once we have the treatment plan entered into the system, we've outlined the area of the retina that we want to treat, we simply position the patient and press the foot pedal, and treatment is just delivered in lightning speed. So this is really ideal for patients who struggle to tolerate bright flashing lights for an extended period of time, who end up squeezing, tearing, and who simply just can't maintain that positioning for an extended period of time. I think the highlight of the Navilas is that it's fast.
Yeah, I've definitely found that to be true, especially for patient positioning. I think in general, it's more comfortable. And then, you know, the converse of that is there are definitely some patients who are not as well suited for getting treatment with Navilas, and then we fall back on our more traditional lasers, the indirect or the direct laser. And I think it's important absolutely for residents and trainees to know how to do those lasers as well. And then kind of what situations would you choose to use those over the Navilas?
That's a great point. You know, I've had patients who are not treatment naive, who have received prior PRP treatments, and they're just used to the slit lamp and the pace of the slit lamp or the indirect laser, and that's what they're used to and that's what they're expecting. So unfortunately, some patients just won't tolerate newer technologies or a change from the traditional. So I think patients who have difficulty with, you know, positioning or even, you know, some cognitive impairment may not be able to sit at the slit lamp or the Navilas apparatus. These patients are sometimes better suited for indirect laser. Patients with small non-peripheral tears or holes may be suited for indirect laser or slit lamp, which has a little bit of a faster setup time.
Yeah, I agree with that. If a patient had a really small hole or even a tear that was not super peripheral and you know wasn't difficult to see, I think probably it'd be easier to just kind of whip out your slit lamp or your indirect. But for patients who need more laser than that, even though there's a little bit of that extra setup time with the Navilas, in those cases it's definitely worth it because you gain so much extra time during the treatment phase.
Yeah, absolutely. So what do you think about the Navilas as an education tool?
Yeah. So I think really the obvious advantage of Navilas, you know, for trainees is that when we're first starting out, you know, your attending or your fellows looking at the retina and, you know, kind of describes to you or maybe like points to, you know, a fundus photo and says, you know, this is where we want to treat. And then you go and look and you're not sure if you found the same spot. I think we've all had that experience where you're like, I'm not quite sure if I need to go, you know, a little more temporal, a little more superior. But with the Navilas, because we're taking an infrared image of the patient and we're all looking at the same picture on the screen, you know, everyone's on the same page. And then when you're basically pre-planning your laser, you know exactly where it's going to go. Everybody is in agreement. You know, it's not theoretical, but this really happens in real time. So, you know, the attending or the fellow could outline the treatment plan. You could outline the treatment plan as a trainee and they can approve it. And then everyone can participate together in actually administering the treatment because they can stand there and kind of watch it happen. And the other advantage, and we'll go into this a little bit more with safety considerations, but it allows you to mark kind of no-go zones so that there is not a danger of a trainee accidentally hitting, the optic nerve head, or the macula or any other place where you didn't want to deliver treatment. And I think that helps a lot, definitely with resident anxiety about placement of laser spots, and probably I would imagine also supervisor anxiety. What's your experience with laser safety, and then thinking about using Navilas versus other modalities?
Yeah, well, when first starting off with laser, residents can be extremely nervous, just like you mentioned, about applying laser treatments to patients' retinas, as the learning curve is steep. Identifying the area requiring treatment can be challenging for someone who's initially learning the indirect. Given the limited view and reversed orientation, that makes it especially difficult. So, a clear benefit for new residents using the Navilas is that the anatomy is in native orientation and displayed on a screen in wide view format that everyone can see. That's the best part.
Yeah.
Patients can also be nervous about receiving laser treatment, as it can be somewhat uncomfortable and they don't know what to expect. So I think like getting them on the Navilas and showing them that treatment can be fast and quick is beneficial for patients to get over that anxiety. There are, like you mentioned, a few safety features that are present within the Navilas system that aren't necessarily present in traditional indirect laser systems. So, as you mentioned, there is the ability to put in this kind of no-go feature where we mark on the retina, do not fire here on the optic nerve head, do not fire here or around the fovea.
The papillomacular bundle, yeah.
Yeah, exactly. And so this is based off the fact that the Navilas system has this really cool eye tracking system where the patient looks away during treatment or jumps or is startled, the system shuts down and it doesn't allow for additional laser to be fired inadvertently hitting the fovea. So this really helps to decrease the anxiety that's felt by the resident about, inadvertently, hitting something important. And so the additional safety feature, which I really like, is that the system allows for titration of a test burn, if you will, and allows you to adjust the power and or pulse duration during treatment. So this is really important just to make sure that, we're not starting off with, a burning hot laser initially with treatment.
Right. Or getting good uptake, but not over treating. And one other thing is that you can stop in the middle of your treatment plan, retake a photo and look at your uptake and adjust the treatment plan too, which is really nice. I mean, you can do that too with, the other lasers. You can just look at the laser you already did. But you can also do that with Navilas. It's not a lost feature.
Yeah. And every time you stop and take a photo, you're actually documenting your work. So I think that's really great.
Yeah. Right.
But the thing, these additional kind of safety features are really quite helpful in alleviating resident anxiety, especially when you're treating an equally anxious patient.
Right.
As the uncontrolled eye movements and the jitteriness can result in laser treatments to unwanted areas.
Yeah. Yeah. And then kind of just like harkening back to these patients who are photophobic or have small pupils, it can be really, really hard to get the view, and you could work really hard and kind of like get a glimpse and get a few shots in, with the other types of direct or indirect laser. But, when you have that lens and you have the photo, you could really see to the periphery really well and refocus as many times as you want, which I think is really helpful.
Absolutely.
I consider that kind of like a safety feature because it makes us better at our job. Yeah. And communicating with our patients is really important so that they understand, what we're doing, what to expect. And I think we're all kind of like always honing our spiel when we're telling patients, giving them advice and counseling them so that they can make good decisions for themselves. How do you talk to your patients? Kind of what do you tell them when you're recommending getting laser and you're planning to use the Navilas?
Yeah, that's a great question. So I think it's important to be clear and reassuring. We really educate patients on what to expect before, during, and after the procedure. And it's really important to set expectations and address any concerns that they may have about the entire process. So, I typically tell patients that, the laser shots may feel uncomfortable, kind of reminiscent of a rubber band snapping on skin.
Mhm.
We also emphasize that patients, they really need to stay positioned for extended periods of time while getting treatment with their forehead pressed firmly against the forehead strap. I noticed that patients tend to try to help us by looking into the direction of the laser, and I always tell them, try to fix on my ear or fixate somewhere off in the distance behind me. But additionally, I like to highlight the precision and added safety of the Navilas system just to help them get over any kind of anxiety about getting treatment. And so, this really helps to just manage their expectations and overall improves their satisfaction and overall improves outcomes.
I think our collective experience as residents is that we're able to complete these like big laser treatments more often. Patients need fewer breaks and they're not as grumpy with us afterward, if they were uncomfortable. So I agree with that completely. In the process of using the Navilas, especially where we have it is at our VA clinic here in Durham. What are some of the like tips and tricks and, for people who are new to the laser and kind of getting used to it? Is there anything that you found or, that you do that we could give advice to other people too?
Yeah, one thing I discovered on my own was just how to adjust the digital overlay to better match a patient's unique anatomy.
Mm-hmm.
So it's really important that when you're taking that initial picture or that map, that you have an identifiable structure in that map, such as a superior inferior arcade or the optic nerve head itself. That just having one of those features in your map helps the computer to recognize the patient's anatomy and overlay the treatment plan onto the patient's anatomy accurately, especially when you're trying to move off into the periphery where you may have a discernible landmark. I also found that you can actually download a fundus image off the Optos machine, and that allows for us to pre-plan treatment, which is really amazing. So what I'll do if I have time and I know a patient's going to need multiple sessions, I'll go ahead and download that Optos image and I'll divide it into quadrants and I'll upload it to the Navilas machine so I can actually put down my no-go zones and put down my treatments, the areas that I want to treat. And so this really allows for, streamlining a patient encounter. So you have everything already set up when they come in, you have them sign their consent, you explain to them again what to expect, you bring them to the Navilas, you bring up your treatment plan, the system automatically overlays the treatment plan, recognizes their anatomy, and you're ready to hit the button. So that's really great. And so, I love that you can get a patient in and out quickly once you have everything set up and you know how to operate the system and move things forward quickly.
Yeah. And then, thinking about using an Optos photo, if somebody had vitreous hemorrhage or for some reason, you didn't have a great view, it was a little bit hazy, you could always have that Optos image to compare to what you can see now or to see what you can't see to better orient yourself.
Absolutely.
That can definitely be helpful.
What has been your experience, coming up with little tips and tricks?
So I think it can be hard to balance holding the lens. You're holding up your lens. You got your little elbow rest, and then you're also navigating the Navilas screen to your right. And when you're first starting out, I think it's pretty similar to doing like a gonioscopic exam. Kind of just the feeling of almost being at a slit lamp and holding up that lens and keeping it steady against the patient's eye. So I think, practicing your gonio exam, could double as, practicing for getting ready to use the Navilas. One tip that I could offer is to always use your left hand to hold the lens up to the patient, regardless of which eye you're lasering. So it doesn't matter if it's a right or a left eye, always use your left hand to hold up the laser, because the way that the system is set up, the screen for the Navilas is always on your right. So you want your right hand free so you can, create the treatment plan, do everything you need to do. Because if you switch hands the way we normally do for a gonioscopic exam, you end up kind of crossing your arms. So I've always been using my left hand. And I think that's been much more ergonomic in my experience. So it's easier to stabilize the lens and And it's just a little bit opposite from what you would traditionally expect to do. Anything else that you can offer in advice or tips or tricks?
You bring up a great point about hand positioning. I think at the outset, when you're starting up with the Navilas setup, and working with the interface can be a little bit cumbersome. With laser indirect, you bring in the patient, you position them, you input your laser settings, you kind of visualize your target before you start, and you laser away. But with the Navilas, there are a few more steps before you can, start the actual treatment. But for trainees, the major advantage is you can share the view and share the treatment plan with your preceptor. And so, new residents can really kind of observe experienced users to familiarize themselves with what is actually being lasered and what the retina actually looks like when it's being lasered. And so, even though there are a few more steps in getting set up, once you treat about 8 to 10 patients, the interface really becomes intuitive and the workflow becomes intuitive. And that's just like with everything in residency, repetition is your friend.
Yeah, I agree. Everything that's new is challenging, and then the more familiar you get with it, it just becomes expected. But yeah, I would agree. Getting the view can be difficult, and so it can be helpful to have somebody with you who's more experienced to tell you kind of how to adjust your hand positioning or adjust the patient to get a better view and then hold that better view. And I think it's a great training tool in that respect.
Absolutely. So, just to kind of wrap this up, as we've discussed, the Navilas laser system just really offers a unique combination of advanced imaging and precise laser delivery. I think the Navilas shines in that it offers real-time imaging, a digital overlay feature, eye tracking system that enhances both patient safety and treatment efficacy. And so, as a doctor in training, or an ophthalmologist in training, I found that using the Navilas, has simply enriched my understanding of retinal anatomy and laser therapy. And so, moving forward, I'll definitely have a Navilas system in my clinic. Yeah,
I think it has a lot of educational benefits, as well as, truly functional benefits in clinic. As I said, I think the duration of treatment has been the biggest advantage for the Navilas, especially with patients who need panretinal photocoagulation. And then in terms of training, just kind of the hands-on learning for looking at the retina, identifying the areas of treatment, planning where you're going to put laser, where you're not going to put laser, and then actually executing it. I think it has been really great in general for us. Like I said before, I think it's really critical for everyone to know how to use indirect laser as well as direct laser. I don't think you can skip those over, but I think that the Navilas definitely has a lot of advantages that we sincerely appreciate. And at the bottom line, of everything is to optimize patient care, and we want to do the best thing for our patients and give them the best that we have to offer. And I think that Navilas has definitely added to our ability to do that for our patients.
Well, I just want to say thank you so much, Kelly, for sharing your experience and your insights. I think you have provided everyone with a really comprehensive understanding of how the Navilas system works and how it's beneficial, or how it has been beneficial in our residency program. So thank you.
Yeah, thank you, Richard. You are very enthusiastic about Navilas, and I think most of us are here. We've definitely benefited from it, and hopefully other people can hear about it and benefit from it as well. So happy lasering to everyone out there.
Yep. Thank you, everyone.
As a clinical trainer and training programmer, there are several pearls of wisdom that I've extracted from teaching institutions such as Duke Eye Center and the Durham VA healthcare system, which have proven to be really helpful to laser trainees on Navilas across the globe. Navilas offers more than one way to get the job done well, and it can help the doctor in training to learn any application of laser faster and more proficiently if they use a stepwise approach. Start with the basics before progressing to the more technical things. Allow time in the beginning to go slowly, prioritizing mastering the fundamentals and, over time, building on the fundamentals to become more proficient and more efficient. Remember to return to the basics and repeat, repeat, repeat. And in collaborative user groups, the tried and true method of watch one, do one, teach one remains very useful. Get feedback along the way, taking advantage of the on-screen view with Navilas before, during, and after treatment. Collaborative and instructive planning, treatment, and evaluation of treatment effect on the tissue can easily be done in real time on screen with Navilas. And since Navilas uses digital imaging, these treatment plans and post-treatment images can be shared and reviewed for teaching purposes. In cases where only a few easy laser spots are needed and using the pre-planning step may be unnecessary, remember that Navilas allows you to use ad hoc treatment without creating a registration image or a digital plan. So you can use Navilas as you would a traditional slit lamp laser and skip the pre-planning step on low spot count treatments while still taking advantage of the eye tracking and your laser pattern of choice. Utilize the simulation training mode on the Navilas system. In this training mode, you can capture images, you can practice third-party image import and overlay, and you can simulate full treatments on a model eye or other model participant while the laser is disabled. We also have an app for practice with the Navilas screen-based interface for creating digital laser treatment plans. Our Navigate app provides a simulated experience on another device such as a tablet for creating laser treatment plans on the retina that can be shared for interactive, collaborative, and instructional discussion. The Navigate app for retina laser is available in the major app stores. Finally, all Navilas users have access to our online Navilas Academy, which contains narrated and annotated instructional videos of all the major treatment workflows through the system. Great for novices and masters alike. My sincere thanks to Dr. Donovan and Dr. Morgan for their contributions to our community, and also to their attending, Dr. Sharon Fekrat, for her expert input and coordination of today's session, and for her many years of deep investment in her fellow physician scientists. Thank you for joining us.